So I think we can really take confidence that there are things we can do, and it is normal to be a bit worried, but keep that worry under control, do the sensible stuff, clean your hands lots. You should have access to alcohol hand rub, and I feel like I need to now, so somebody grab me a bit because I just touched a surface and I don't know who's been there, so I'm going to alcohol. So it's really important that we do that, and as you can see I'm just clasping my hands there because I don't know where they've been. Well, I sort of do, but I think
know where your hands have been.
I think alcoholing them is really good, and there's a good way of alcoholing too. Kathy will demonstrate. So you want to get both surfaces of your hands and in between your fingers and actually get that alcohol around the hands, and that gives you the confidence that your hands are clean. Now, the hands are the vector for this virus. If we catch this virus, we catch it from our own hands, and we do know where those hands have been, and the way we catch it is we rub it in our eyes and around our face. So this is the target and this is the vector, and we have to all start being conscious of our hand to face contact, okay? So you have control of that, and you can stop yourself getting this virus by having clean hands and not rubbing your eyes with dirty hands. So that's much more important than the droplet spread that everyone focuses on. If you are dealing with people who have a respiratory virus, so if somebody in your house has a respiratory virus, or one of your patients, or if you're looking after patients with respiratory illness, with respiratory infections, then you do need to put droplet precautions on, and that's where you wear a mask. And if you're going to have clinical contact with them, you know, quite close contact in that 1 metre zone, we would also have you in a gown and gloves. And what we're doing in Dorothy Henderson at the moment in the lockdown situation is that when we need, I go in and I examine the patients if they've got a new symptom, and I will have a gown and mask and gloves on. I still clean my hands lots in that process, okay? And for those clinical people amongst you, you will be familiar with the way you, particularly with you doffing your PPE, your personal protective equipment, you need to alcohol your hands several times in that process, and if you're not sure about that, get some help. There is help around to explain that process to you. But you alcohol your hands at least 3 or 4 times in that process, and it's really important that you do that to keep yourself safe.